Bariatric surgery is indicated in patients who have a BMI of more than 35. The reason for that is once you cross a certain level of BMI, then patients are at high risk for developing serious medical conditions such as diabetes, high blood pressure, sleep apnea. And then these medical conditions can give rise to more serious conditions such as heart disease, strokes, and cancer. Now, there is a lot of evidence that bariatric surgery not only prevents the occurrence of these serious medical conditions, but there's also a lot of evidence that bariatric surgery reverses these serious conditions and can actually help patients live longer, and thus it prolongs the survival of these patients when they have undergone surgery. There are 4 common procedures. In terms of surgery, that's done by laparoscopic surgery. There's the gastric banding, the gastric sleeve or the sleeve gastrectomy, and the gastric bypass. And in terms of endoscopic procedures, there is the gastric balloon. And these are the 4 most common procedures to help patients lose weight. They all have a role to play. They're all effective in different ways for different patients. But the 2 most common procedures that I perform are the gastric sleeve or the sleeve gastrectomy and the gastric bypass. Both these procedures are very effective. They help patients not only lose weight, but also in the sustaining of the weight loss. Of these 2 procedures, if I had to pick one, which I think is most fascinating and most interesting, is probably the sleeve gastrectomy, because in my experience, in terms of weight loss, it is nearly as effective as a gastric bypass. More importantly, without all the long-term side effects of a gastric bypass. That's the easy part of their decision-making process because they have decided that they do want to consider surgery to lose weight. The next challenge for them is to then choose the procedure that they think will work best for them. And I think it's very important to help patients make that choice. But that choice has to be theirs because they're the ones who are going to live with this operation for the rest of their life. Now, all these procedures work really well in some patients and may not work so well in other patients. And the procedures are also chosen based on various other factors. For example, patients' eating behaviors. Some patients may eat very bulky meals, and so for them, a procedure like a sleeve gastrectomy would be ideal. Some patients may already have diabetes mellitus, and for them, the gastric bypass would probably be the procedure of choice. So the decision-making process very much is a partnership between the patient and me, but I would like patients to make this choice, and I can only facilitate that process by giving them the right information. Bariatric surgery is highly successful, and that's the reason why there are so many procedures that are being performed safely and effectively across the whole world. Bariatric surgery's key success measures are weight loss, and a sleeve gastrectomy and a gastric bypass are associated with nearly 25 to 30% of total body weight loss, usually at 1 year to 1.5 years, and these are sustained, we know, even up to 10 to 15 years after surgery. Another success measure of bariatric surgery is resolution of diabetes, which is that diabetes can actually be treated by surgery, and that's a fascinating concept because earlier I think physicians were only controlling diabetes, and up to 50 to 70% of patients can have complete resolution of diabetes.